What is premature ejaculation? Basically, premature ejaculation is the ejaculation which happens very quickly. According to the definition, it is the ejaculation which happens less than in a minute, or when the person does not wish to, or if he doesn't have control over his ejaculation, it is called as premature ejaculation. So there are two types of premature ejaculation. One is primary or lifelong, and the other one is acquired or secondary. Primary is when the person has had premature ejaculation since his first sexual encounter, and the acquired or secondary means that the earlier the ejaculation was normal or satisfactory, but within a course of period, the ejaculation time has reduced to less than 2 minutes, or there is a decline of about 2 to 3 minutes between his earlier time and his present time. So this is premature ejaculation. It is a very common problem. 1 in 3 men have this problem. It's one of the most common male sexual disorders. Most likely, the reason is anxiety in young men. It's the performance anxiety which causes them to prematurely ejaculate. Also, sometimes when men are with a new partner, then there might be premature ejaculation because of excessive arousal. And then there is something called as hypersensitivity, which means the person's genitals are sensitive to touch, and because of the hypersensitivity or excessive sensitivity of the glans penis, which is the topmost portion of the penis, uh, he ejaculates very fast. So sometimes there is a problem with the pelvic floor muscles. When the pelvic floor muscles are too tight or too weak, then premature ejaculation can happen. Sometimes there are other causes like prostatitis, urine infections, diabetes, also thyroid problems. Sometimes there are medications which can cause premature ejaculation. So there are a lot of causes. So whenever a person who has premature ejaculation visits a doctor, the doctor must try to find out the cause and treat the cause, which can help the patient in overcoming premature ejaculation. Important effect which it can have is a lack of confidence. If the man knows that he ejaculates prematurely or very fast, then it will lead to lack of confidence, which can cause performance anxiety and which can in turn cause erectile dysfunction. So this can cause lower self-esteem, lower self-confidence, and the person might become isolated. He might not interact much with women, and I have seen a lot of men who have this problem, and they do not talk to women, or sometimes the pressure of the family, they get married also, and not able to have sex with their partner. So it can lead to a lot of problems for both the patient and for the partner as well. It is treatable. I would not say curable, but it is treatable. As I said earlier, it is important to find out the cause. And if you know the cause, then you can treat that cause, and it can help the person in overcoming premature ejaculation. There are medications which can help you last long. These medications are mostly antidepressants, and they are given in mild doses for a period of 6 to 9 months. And this can help in delaying the ejaculation. Along with medications, pelvic floor exercises are also very important, which help in controlling the ejaculation. And if there are any hormonal imbalances, that needs to be corrected as well, which can help in overcoming premature ejaculation. If the cause is prostatitis or infections, then they must be treated as well. And for any other cause, it is important to treat the cause which will automatically lead to improvement of the ejaculation time. There was a study which was done in AIMS, New Delhi, and it showed that there are 12 poses of yoga, 13 poses of yoga, which can actually increase the the ejaculation time in patients with premature ejaculation. So you must know about these poses if you are suffering from premature ejaculation, because yoga really helps men who have premature ejaculation by calming down the sympathetic system, by reducing the anxiety levels and improving the parasympathetic tone. So that can help in improving the ejaculation time as well. If the man ejaculates before entering the vagina, then it can cause infertility, since the semen is not being deposited in the vagina only. Other than that, indirectly it can cause infertility, because if the patient knows that he is a premature ejaculator, he might become anxious and he might lose his erection, which can lead to erectile dysfunction, and he might not be able to have sex with his partner, and that can obviously lead to infertility, because the couple is not having sex only. So indirectly, yes, it affects, but directly there is no effect. Premature ejaculation can happen to anybody at any point of time. If Because there are multiple reasons, there are lifestyle factors, also psychological factors, physical factors. So I would say, in my experience of dealing with such patients, I would say that it is impossible to prevent it, but yes, you can manage it by living a healthy and active lifestyle. Practicing yoga also helps a lot.